Thanks very much, Jonathan. I'm really pleased to be part of the meeting. I wish I could be there in person, but yes, schedules and pandemics got in the way of that. A pie and a pint in Ripon sounds really attractive to me right now. Um, but we'll make the best of what we can do using technology, which is only fitting since that's really our subject for this afternoon. So I'm going to speak a little bit to veterinary applications of sensors and data. I'll spend a few minutes sort of setting the stage on where we're at and perhaps setting expectations, well, for the talk, but more to the point for application of technology in the field. Spend a chunk of time on applications in reproductive management, estrus detection, because that's most well established, a little bit on using technology and sensors for detection of transition cow health problems, and a couple of words at the end on automated milk feeders for calves. So lots of tools and tech out there. I think we've got that well established. I'm going to focus primarily today on things that are commercially available already and somewhat in use. So those will be cow wearable sensors, primarily focused on activity and rumination. Obviously, there's lots more out there already, from inline milk sensors to sensors that go inside the cow rather than on the cow. The point I want to underline here, that's still very much a work in progress, is the need for all of these streams of data increasingly coming from different bits of kit from different suppliers, is to integrate the streams of data coming off of them in a useful and actionable way, and ultimately to integrate and marry up the streams of data coming from conventional sources, milk weights, human observations, simple cow demographics, and hopefully in the future getting systems talking to one another to really achieve some synergies on the data processing side of things. So just to set the stage a little bit, and I expect this has been discussed in some detail already, but why are we interested in these nifty gadgets? A big part of it is a lack of labor, particularly a lack of skilled labor, good cow people, so to speak. To some extent, it's probably true, certainly in our world, that farmers are not always keen on managing two-legged animals, preferring to manage four-legged ones. And if they can buy technology to help them do that, that looks like a good thing. But ultimately, technology for cows should be one or more accurate than the alternatives, or get things done in a way that we couldn't otherwise get done, faster, sooner, better, cheaper, more objectively. But my perspective or bias is that the primary use of these things presently and even into the future should be to enhance and augment the role of skilled humans. So to make more efficient use of both cow time, so by sorting away cows that should be left alone to eat, drink, lie down, chew their cud, and do the things we want them to do, and to use the time of skilled humans more efficiently by having some pre-screening, pre-selection, augmentation of decision supports for those skilled humans, but ultimately, for the most part, not to entirely replace them. And so really what we want to know as farmers, but also as people advising farmers, is very pragmatic. Which cows need something done to them today? Need, or more to the point, which cows would benefit from something done to them today? And we'll circle back to that, because even enhanced detection doesn't necessarily mean that we know exactly how to make them better today or tomorrow than if we left them alone. What we tend to get presently are fairly granular data, bits and pieces, increasingly put into somewhat smart lists, but still rooted quite a bit in very interesting graphs on a cow-by-cow basis, which is one thing if you've got 50 cows, but very different if you've got 500 or 800 or 1,000 cows or more. Nifty graphs aren't really going to cut it. So we've got really useful bits of granular data, but what we want is to synthesize that into who would benefit from some action today and who could we or should we leave alone. And I won't dwell on it, but something that's also very much a work in progress is turning these cow level data into herd level metrics, because again, as herds get bigger, and even for small to medium size operations, we want to be able to analyze things at the herd level. And at least some of our kit is not super strong on that yet. Okay, into reproduction to begin with. And again, this is a rather busy slide, but the point is activity monitors are very well established for estrus detection and managing of breeding, and rightly so. Their ability to find cows in heat is very good. When they flag up a cow as being in heat based on activity, the false positives on that are relatively few. In other words, the positive predictive value is quite high. If it says the cow's in heat, she quite likely is. If you can cast your eye down the sensitivity column, the point I want to make here is that, with a few exceptions, but practically it's nowhere near 100%. In other words, we can't expect any bit of kit, at least existing and probably into the future, to detect 100% of estresses. And I'll come back to this. We can go a long way with this, but we also need a complementary system, a backstop system, to really achieve herd performance and economic goals. Okay, into some details. So again, the technology of activity-based monitors for repro is well established and reasonably widely used, and that's still growing, at least here, and I expect in the UK as well. How can we fine-tune it, make the best use of it? Well, one thing that's quite repeatable is that the higher the peak of activity, the better is the prognosis. In other words, the more likely the cow is not only to actually be in heat, but actually to get pregnant off of a service time to that alert. This is just one snapshot of some data from a review paper by Ronaldo Seri that I was involved with a little bit, but this has been replicated in many studies. Typically, cows in heat about triple their baseline activity. And in fact, that's a pretty useful thumb rule that if they're at 300% or more of their own baseline, that is a favorable thing for the likelihood of them getting pregnant to that estrus. Whereas if they're over their threshold, which is, depending on the software, might be somewhere around a doubling, roughly, they may well be in heat, but their probability of pregnancy is going to be meaningfully less. There are studies on both sides of this, but so some saying that as cows' milk yield at or around the time of estrus is greater, they might show heat less well, less intensely with a lower peak, but that's not necessarily the case. So again, this is one bit of, for example, data, but in this data set, you can see it's just a scatter of points. There's not necessarily a correlation, a negative correlation between milk yield and peak activity. This is from another set of data from a large study recently published out of Germany from 8 farms, all with SCR activity tags. And again, this illustrates what you would see in other studies as well, that there is a correlation between the intensity, the height of the peak of the estrus, and the duration, for how long, how many hours the cows are above the threshold. Each of those things in most studies is favorably, positively associated with pregnancy, but they're correlated one to the other. And interestingly, this was one of the larger published data sets. It was the peak, but not the duration. So how high above the baseline the cow was, but not per se for how many hours that was associated with fertility. So that's illustrated in this slide. Now this is, they tried to and did control for quite a number of other factors. Given the activity, the duration, as I just said, wasn't associated. The rumination minutes change, or the rumination index, wasn't associated, even though looked at in isolation, there is an association of that with estrus. Again, milk yield wasn't. They looked at cell count. All those things weren't. They controlled for parity, which typically is associated with both peak of activity and ultimate pregnancy. Heat stress, and a few other things. So the take home is, again, peak mattered. High peak is better. Again, you have to take this with a couple of grains of salt. Very large study, multiple herds, that's a strength. The overall pregnancy per insemination are a bit crap in the 20s, not what we're after. Nevertheless, the relative pattern is what I'm trying to illustrate here. This is back to some work from colleagues in Canada. Again, just to drive the point home, this is about 300 cows, 850 heats, all one herd, but the cows were wearing 2 different tags, and their performance wasn't really different. But some take homes here again, from the onset of estrus based on passing the threshold of activity. Ovulation takes place about 25, 26 hours later. The range is from 19 to 30, but in multiple studies, they're all going to be in that ballpark. So roughly coinciding with the onset, coinciding with the LH surge. So that makes management quite useful. Again, higher peak, longer duration associated with increased pregnancy. So for example, whether it's by the arbitrary units in the SCR system, or whether it's by the actual fold increase, so a 330 fold increase, sorry, 3.3 fold or 300% increase. Again, pregnancy per AI going from about 42% in high peaks to about 32 to 36% in low peaks. Likewise, durations over 12 hours, about 43% pregnancy versus 32 for shorter heats. Cows that are lame, down at around 32% versus cows that are sound at 42%. And last but not least, animals in their first lactation just have a sort of a different baseline, higher than older cows. Off to Wisconsin for a study that went head-to-head of sort of going all in on synchronization timed AI versus trying to make the most use of activity monitors. And there's quite a lot in this study, but I just want to pull out a few points for today. So all the cows got 2 shots of prostaglandin 2 weeks apart, and then had a 12-day period in which they could be detected in estrus. They all wore activity tags. One of the first take-homes is that about 70% of the cows actually showed a heat, whereas 30% of the cows weren't detected in heat based on activity, and went on to be inseminated based off the synchronization protocol with timed AI. And that looks to be a very repeatable number. We can get about 70% of the cows picked up with activity, but that we still need a plan B for the other 30%. The cows in their timed AI group, so they also wore activity tags, but irrespective of showing a heat, they all went on to the timed AI. Again, 70% of them actually showed a heat, or a heat was detected. And indeed, that was a favorable thing. Even though they went out to a timed AI, their pregnancy to that was 40% versus 30% for the cows that didn't show a heat previously. And so at the end of the day, by design, there were some differences in their time to first AI, but by about 80 days, essentially all the cows had received a first insemination, and they went on with their reproductive life after that. And at the end of it, and again, this has been shown in multiple other studies, accounting for the costs of labor and the costs of hormones to go heavily in on timed AI, or accounting for the costs of buying and amortizing tags and software and so on, it's a tie. It's a tie in the long run pregnancy rates in the herd, and it's a tie in the economic return as well. And I'll circle back to that briefly, but that is a highly repeatable pattern, looking at going heavily, but not exclusively, in on activity, complemented with a plan B backstop, or going very heavily in on synchronization. But like all averages, there's variation behind them, and one approach will probably look better in some herds than others. So this is another study back to colleagues from Canada, just to illustrate that. They did more or less the same setup. All the cows got 2 shots of prostaglandin 2 weeks apart. Half of them carried right through and got a timed AI at the end, and the other half were bred to the extent possible off of activity-based heat detection. Again, on average, it was a tie between the two, but as you can see here, there were some quite stark differences between these two commercial herds in the prevalence of lame cows, going from moderately high to extremely high, prevalence of anovular cows, prevalence of skinny cows, and not a minor point, their compliance with the timed AI protocol. So that's not foolproof either. If the right cows don't get the right interventions at the right time, those programs aren't going to shine either. And this is quite typical, that anywhere from 15 to 20% of cows on a multiple intervention program are not going to get everything that they were supposed to at the right time. And predictably, then the system may not look so good. So again, that's a bit back to the idea. On average, it's a tie, but on a herd by herd basis, one program may look better than another. Some of our work now, again, trying to fine tune with these systems. We put 4 herds on a observational study for over a year. 2 of them had the AFI system, 2 of them had SCR. This was done a few years ago, and so these were the previous generation systems which transferred data when the cows came to the milking parlor 2 or 3 times a day. That matters a bit because one of the key outcomes was looking at the timing from the alert to when semen actually went into the cows. These herds all relied exclusively on the activity system from 55 to 80 days in milk. And so that gave us the opportunity to see how well the system could do left to its own devices with a relatively hands-off approach, at least in the first instance. After 80 days, the cows could and did receive some kind of intervention, typically a 3-shot OV-sync program to put an upper limit on their time to first insemination and to cure semen deficiency. And going forward, then the cows continued to be bred off of a hybrid of activity-based and cleanup with timed AI-based breedings. So at week 5, the cows were all checked with a MetroCheck device for pus discharge, reproductive tract infection, blood samples at weeks 5, 7, and 9 to measure progesterone to see which cows were actually cycling, a lameness assessment and body score assessment at week 7, just before the cows were released for breeding, so to speak. We had 1,000 cows with a full set of postpartum samples and activity data for just under 1,400 breedings. We dug into the software, which was a bit of a job, but and pulled out the timing of the alerts and so on. The producers wrote down the time of day they actually inseminated the cows. And so first set of take-homes, we actually somewhat exceeded expectations. This actually was quite consistent among the 4 herds. Over 80% of the cows were actually detected in estrus by 80 days in milk with no intervention. Some of the things that were associated with that would tend to pull that number down. One was simply being an older cow, as we've already seen, that and each of these is considered in isolation in this analysis, pulled that down to 70%. Cows with pus discharge at week 5, again, pulled that down by over 10 percentage points. Cows that were anovular by 60, 63 days in milk, pulled that down, unsurprisingly. And completely unsurprisingly, cows that were skinny and lame pulled that down. I mean, it's remarkable it didn't pull it down even further, but pulled it down substantially. We took blood samples as well. I think I skipped past that, but in addition to the postpartum samples, we took blood samples on the day of insemination. And if blood progesterone was high, we could say that the cow was not in estrus. So they'd got the timing wrong. They were sort of off by at least a day, or perhaps off altogether. One bit of encouraging news was that for both the activity-based inseminations and, for comparison's sake, the timed AI protocol hormonal synchronization inseminations, this was remarkably good. Only 3-4% of the cows had high progesterone on the day of insemination. In other words, they just were not in heat. They got it wrong. But that's remarkably good. In studies where humans look for cows in standing estrus, typically that error rate is 5 to 10%. So this was really very good. One slightly unexpected wrinkle was that we found, digging into the data, that 17% of the estruses flagged up by the automated activity system, the producers actually didn't choose to inseminate the cow on the day. And that they weren't flagged up in the system as being do not breed cows, although perhaps they were in the producer's mind because they were lame or mastitis cows, or they kicked at milking, or they were ugly, or whatever their problem was. But that probably didn't explain everything. And so the point here is that nearly half of those cows that the producers, we think, subjectively made a judgment call not to breed, even though the software said they were in heat today, nearly half of them indeed were not in heat today. We can speculate that perhaps they had just barely passed the threshold. So either their duration or their peak were relatively low, and the producer was exercising a bit of a judgment call. Perhaps they were going to breed them tomorrow, say. But the point being that perhaps a little bit of human discretion may actually be a good thing in application with a software system. Even if we folded those back in and one just bred entirely off the list with no subjectivity to it, the error rate, even if you just put semen in all those cows, would jump up to 9%. But actually, that's still pretty good and not worse than the alternatives. So I think still quite workable. Last but not least from this study was the timing of insemination. So here, sort of an on the one hand, on the other hand set of results. So the yellow bars represent multiparous cows, so second, third, fourth, fifth lactation. And I guess the good news was there's some latitude in the timing. So whether semen went into cows within 8 hours of the estrus alert, 8 to 16 hours, or 16 to 24 hours, the pregnancy per insemination was equally good, or if you're a bit more cynical, equally bad, because they were all in the low 30s. Nevertheless, it seems there's some latitude on timing there. Once a day action looks to be a viable option. Conversely, for the first lactation animals, timing mattered. Specifically, putting semen in those first calvers within 8 hours of the activity-based alarm looked much better. 49% pregnancy per AI there versus 36% if that was delayed for 8 to 16 hours, and it fell off again a little bit further if it was delayed out to 16 to 24 hours. Okay, moving on, we did another large study a couple years ago, and this was to sort of take, I don't know, extremes, I suppose, and try to compare heavy use of activity, sort of wring as much of it out of as we could with the least possible intervention, understanding that that wasn't going to be 100%, so a backup plan B is needed, a backstop program, or to kind of go completely the other way and say, right, we're all in on synchronization, we'll really take a completely different view on this. And so we set this up with 2 farms, and the cows were randomized within farm to either go on a highly interventionist program, so double OV-sync, sort of the Cadillac, or I suppose, depending on your perspective, the nightmare of synchronization. But anyways, 6 injections per cow, timed AI for everybody at the end, a high degree of control of the estrus cycle, and what should be a high degree of synchronization and hopefully high degree or high rate of pregnancy at the end of the whole thing. Or giving the cows 25 days, more than a full estrus cycle from day 50 to day 75, hands off, maximize the use of activity, au naturel, and then simply clean up at the end with a 3-shot OV-sync program to get semen into the stragglers. So 2 largish herds in our part of the world, milking 500-600 cows apiece, one with an AFI system, the other with a Bomatic system. Once the dust had settled, we had good data on 850 cows, roughly half and half between the 2 groups, again, randomized within herd, of course. And again, it's only 2 herds, but it does come back to my theme of there's an it depends to this. So if we look at pregnancy per first AI, pregnancy at first AI, there was a difference between the 2 herds. So the 2 approaches gave a tie in herd number 1, whereas in herd number 2, double OV-sync, the synchronization program, excuse me, looked better. But remember, the whole name of the game is not pregnancy per AI. We're not trying to meter out precious semen, but rather get cows pregnant in an efficient way. And so ultimately, we're comparing 2 programs, 2 approaches that had every cow bred by 88 days. And you can say, well, that's not a fair fight, because in one group, a cow that came in estrus early, got bred, didn't get pregnant, comes back into estrus. She has 2 chances to get pregnant, get inseminated and pregnant between 50 and 88 days. And indeed, that's true, but that's the nature of the program. And so perhaps not surprisingly, things shifted such that if we said how many are actually pregnant by the end of our program, now in herd 1, things look a bit more favorable. We've got half the cows pregnant, an advantage activity system, whereas in herd 2, things didn't shift very much. We now have a tie, but so if we go backwards there, things have come up in the green bars in both cases, but differentially so. And again, that I think is one of the take homes, and that's where, just like with every other bit of management, it's not necessarily a one size fits all. And that's where producers have smart decisions to make, and as advisors, we hopefully earn our keep in helping bring data and critical thought to what's going to work best in this herd versus that herd. So activity-based breeding can take us a long way, achieving insemination rates or heat detection rates probably in the order of magnitude of 70%. So the glass is more than half full, but we need a plan B. There's got to be something in place to ensure that there are upper limits set on time to first insemination and to repeat inseminations subsequent to a non-pregnancy diagnosis. And in most cases, that's going to mean some kind of synchronization program to ensure that cows aren't suffering from semen deficiency. How we actually fine-tune that herd by herd, again, should be a data-based decision. Obviously, producers' requirements, milk buyers' requirements, producers' preferences all come into that. So again, not one size fits all, but it's certainly not optimal or probably recommended to be entirely hands-off if that's a viable option for a given herd. And to make sense of that, as advisors, we'd like producers to record the data so that we not only know when a cow was bred, but whether that was based off of activity or human observation or some kind of intervention, so that we can keep score and make database decisions. Again, this is a very viable option. We can go heavily, but not exclusively on activity-based breeding and achieve equal pregnancy rates over time, equal economic return on average over time, but that's going to depend on things like prevalence of lameness, prevalence of anovular cows, stocking densities, prevalence of skinny cows, how well the activity system actually functions, because they're not foolproof, how well other intervention programs work, because they're obviously not foolproof, whether it's feasible to act on the list, activity list, and breed cows more than once a day to fine-tune the system. All of those things will go into those herd-specific decisions. Okay, a bit of a segue here to a few words on transition cows. These are some interim data from my PhD student, Tony Bruinje, who has done a study where it's done in the field now and he's crunching through the data, but here's a sneak peek at a bit of it. 2 herds milking about 450 cows apiece. Each has an activity system, and our goal here was to look at transition period health, peripartum health, in considerable detail, and look at which factors are associated with cows actually expressing estrus and being detected in estrus with an activity system. So how can we fine tune and get the most out of that system that we possibly can? So Tony was out to these farms, each farm twice weekly and sometimes more, intensively monitoring cows' health, including blood samples and cow observations and so on. And in each of these herds, they were hands off with the cows from 50 to 75 days in milk. So as cows had heats, naturally occurring heats by then, they were inseminated, but there was no intervention with the cows until then. Again, we got about 72% of the cows had shown an estrus by 75 days in milk. If we were even more precise, saying we don't, some of them had early heats, but then not in what for us at least would be the breeding window of 50 to 75. So 63% of the cows had a detected estrus between 50 and 75 days in milk. So again, that extra 10 percentage points had shown a heat prior to that, but then not in that particular window. When you really intensively monitor cows, including biweekly blood samples to measure calcium and ketosis and NEFAs and haptoglobin and so on, not surprisingly, we find lots of cows that at least have one risk factor or are into a higher risk category. In fact, about 70% of the cows had at least one issue that would put them into a higher risk category. So, a low calcium, a high ketone, a clinical disease, etc. So about just under 40% had at least one form of clinical disease, so retained fetal membranes, lameness, mastitis, metritis, etc. And then more again if you're really intensively monitoring it. And that, I'm sure, seems high. It is high, but frankly, it's actually quite typical if you're monitoring at that level of intensity. And several of those factors were associated with reducing the probability of being detected in estrus based on activity alone between 50 and 75 days in milk. And I won't go through these in detail, but some of them were the usual suspects: cows that were fat going into the close-up dry period or skinny at 9 weeks postpartum had less likelihood of being detected in estrus. Cows that were lame, unsurprisingly, less. Cows with high haptoglobin, so perhaps in a state of systemic inflammation at 6 days in milk, less likely. And some parity conditional effects, ketotic first lactation animals, multiparous animals with pus discharge at week 5. Each of these things reduce the likelihood of being detected in estrus in the window we were after from 50-ish% down to 40-ish%. If we summarize that, and again, remember, these are interim data, but cows that had no clinical disease, again, 70% of them found in estrus in that window. Cows with one clinical disease dropped down to about 10 percentage points less at 58. Cows with 2 or more clinical diseases, another 10 percentage point drop down to just half of them. Specific to uterine disease, again, about the same picture. 70% of the cows without uterine disease, but they could have had some other kind of disease. Again, 7 out of 10 detected in estrus, and just more than half if they had lived through a uterine disease. Okay, a couple of others here, bit of a tiptoe through these quickly, but one of a PhD student who I had the chance to work with, Megan King, she looked at cows from 9 herds in Ontario, all robot milked herds. So this brings in both the activity and rumination data, but also some streams of data for the cow's interaction with the milking robot. So milking frequency, milk yields, milk conductivity, milk temperature, etc. She also went to the farms weekly and measured blood ketones, scored lameness, looked for pus discharge, and the producers, as they would, were checking for and treating mastitis daily and finding off-feed cows that had displaced abomasum. So the prospective checking for those additional conditions. What comes out of this, and again, I'm not trying to drill into the details here. First of all, take this with a few grains of salt because the numbers of clinical cases here are quite small, but these patterns are fairly repeatable across a number of studies. So in this case for clinical mastitis, which are the cows shown on the red line, you can see that there's quite a bit of daylight in a number of indicators between cows that had mastitis and cows that stayed healthy. So whether it's milk yield, rumination time, activity time or index, milking frequency, again, they're voluntary visits to the robot to be milked, milk conductivity in this case, because it's mastitis we're talking about. In every case, there's substantial daylight. In every case, these markers are starting to change and deviate many days, 10, even 13, 14 days before the farmer detected the clinical mastitis. Ditto for displaced abomasum. In fact, there's even more daylight between the lines, same thing. Likewise for lameness, although now you see bigger error bars and less daylight. And last but not least for ketosis, now we've got more cases, but again, the patterns are there. The point I want to make here is maybe twofold. Number one, these things look really clear when you look at them with the benefit of hindsight. So in each case, the day of diagnosis is on the far left, the far right of the panel. However, if you're the farmer looking at these data in real time today, it's much, much less clear. The absolute value, say, of rumination time, of milk yield, milk temperature, etc., wouldn't in most cases, just as an absolute value looked at in real time, jump out as being obviously abnormal, with the possible exception going backwards of, cows that were going on to have displaced abomasum. That tends to be the one that's the most stark. But for clinical mastitis or for ketosis or lameness, looked at in real time, that's much less obvious. So on to another study, this one done in New York, and one herd, very high producing herd, milked 3 times a day, 1,200 cows worth of data, cows wearing the SCR tags for activity and rumination. The combination of those two things, activity and rumination, produces a health index in arbitrary units, but where 100 is good and fine, whereas less than 86 units was a flag that the cow had something happening or brewing in terms of a health issue. These cows were monitored by trained humans very intensively, locked up and examined daily from 1 to 10 days in milk and periodically afterwards. Those humans were blinded to the activity index data, but they did have milk production data. And they checked the cows for ketosis, mastitis, displaced abomasum, etc. There were actually 3 papers out of this, a large body of work, really good stuff, but I've summarized it here. And what I would underline, if you look at the sensitivity numbers, so the ability to detect cases, it was outstanding for displaced abomasum. Basically, every cow, or 98% of them that had displaced abomasum, was flagged up by this health index score based on activity and rumination. And in fact, they were flagged up on average 3 days before the humans diagnosed the twisted stomach. Likewise, for ketosis, more than 9 out of 10 cases were identified by the activity monitor on average a day and a half before the humans found the cow with the urine stick turning purple. But then it falls off a bit. For metritis, the sensitivity was only 55%, which means just barely better than tossing a coin. And likewise, on average, for clinical mastitis, a little bit better than flipping a coin, with about a half a day's advance notice. Specific to cases of mastitis, clinical mastitis caused by E. coli, perhaps because the signs are a bit more obvious or stark, the sensitivity was actually better, but again, not with a great deal of lead time. And this sort of illustrates the promise. This illustrates that not all diseases are the same. So again, as you saw previously, DA and ketosis look to be more readily flagged up, at least on the basis of activity and rumination. The big question, though, is what do I do with this information? Even if I take for the sake of argument that it's really accurate, what do I do knowing, so to speak, that a cow is going to have a displaced abomasum 3 days from now? At this point, we don't have a way to head that off. Probably not going to go ahead and do surgery on her preemptively. And that's a bit of a recurring theme here is this can be quite useful, but at this point, we mostly don't have the means to change the course of what appears to be coming or improve the outcome as far as we know. And so, yeah, this is a summary panel from that same study. Again, not trying to sweat the details, but across the top is rumination time, activity index in the middle, and this health index score, which is sort of a summary of the two across the bottom. And again, you can see for displaced abomasum and ketosis, there's quite a lot of daylight between the affected cows and the healthy cows. Here, they all start 5 days before diagnosis, and they're already substantially different. And then after diagnosis and treatment, you can see something about how quickly they tend to recover, days. Whereas much less daylight for clinical mastitis, not deviating until closer to the human-based diagnosis, and so on. Yet another study, this one's fairly hot off the presses, from some work in Florida, 500 cows from 2 farms, again wearing the SCR activity and rumination tags. Here there's 120 cases of cows with metritis. They were all treated with one antibiotic or the other. But the question here, which I think is a really good one, is how much better could the detection be if you augment routinely available data? So is it a young cow, old cow, tough calving or not, live calf or not, twins or not, past the membranes or not, did she have a vaginal tear, all the things that might be risk factors for metritis that are readily available or routinely available. That gave an accuracy of detection or prediction of metritis of about 70%, which is pretty good. Not fabulous, but pretty good. If you used the computer-based data alone, with data up to 1 day in milk. So again, remember, metritis here was diagnosed on average at 6 days in milk, minimum of 4 days in milk. So if you had the prepartum data up to day 1, you could be at 64%, or up to day 2 postpartum, so 2 days after calving, but still before the onset of metritis, you could have equal accuracy to the routine way of doing things. If you augmented the routine data plus the behavior data, we could gain 5 units, 5 percentage points of accuracy of prediction up to 75%. So there is something to be gained. It's not huge, but there's something. The other thing they showed, again, it's 2 farms, but they did an exercise to analyze the data based on 1 farm and apply that same set of equations or equation to the second farm. And in that case, the accuracies of prediction were meaningfully lower. And so again, it's N of 2, but it would appear to suggest that perhaps these algorithms, well, they either need to be more fine-tuned or more robustly built, or perhaps they actually need to be done farm-specific if there's sufficient data to do so. And so again, from that same study, the other thing they did, which was quite interesting, they looked not only at predictive, but now these are centered on the day of diagnosis and following cows subsequent to treatment. So the orange lines are cows that had metritis, were treated, but didn't cure. In other words, they still had stinky discharge and or fever a week after the end of their course of antibiotics, whereas in blue are the cows that had metritis, were treated, and did cure, and in black are cows that were healthy, didn't have any disease at all. And so again, you can see there are noticeable differences between those that did and didn't cure. Now, again, what do you do with that? Are we going to make a prediction on the day of diagnosis and withhold treatment? Probably not. But the point is that we can begin perhaps to inform selective treatment decisions or tailoring treatment decisions based somewhat on prognosis. So again, that's what they looked at here, the accuracy of prognosis or prediction of cure, which again was a little bit better than the prediction of a case to come of metritis. So here we're up to about 80% with small marginal gains in accuracy when we add behavioral data on top of routinely available data. Very quick point here on a completely different use of technology, not for detection, not for prediction, but actually for application of therapy. So this is a study that we've just published from my colleagues, using robotic milkers as a way to administer therapy, where the therapy was reduced milking frequency as a treatment for metritis. So screened a whole bunch of cows on a milking robot to detect ketosis. All of the ketotic cows, of which there were just over 100, went on propylene glycol drenching for 5 days, but half of them were assigned to be milked once a day on the robot, and the other half were assigned to be milked twice a day on the robot. And sure enough, going to once a day milking substantially improved the cure rate of ketosis. In fact, in primiparous cows, first lactation animals, it cured them all. By the 3rd day of once a day milking, none of them were ketotic anymore, and they stayed that way. What we decided to do to be sure to test our concept was that we put the cows on once a day milking for 2 weeks. And that turned out to be much longer than we needed to or probably should have done. So the good news is that it did substantially improve cure rates to go to once a day milking, particularly effectively in first lactation animals, less so in multiparous animals, but the pattern was similar. But by milking them once a day for 2 weeks, we also substantially reduced their milk yield at least to week 15, so through some months of lactation. Now they were converging, but by the end of the study, we had lost 14% of their milk yield. So if we were to do this again, we would probably try the once a day milking for 3 or at most 5 days, not 14, but that needs testing in a proper trial. So to summarize, the wearables and or some of the milking robot and or inline sensors in milking parlors are really promising. There are measurable differences in numerous behaviors or detectable things: activity level, rumination time, attendance at the milking robot, supplement intake in the milking robot, in the case of mastitis, conductivity. And these things are present many days in most cases before the onset of mastitis or other diseases. But what to do with that in real time, it's much clearer in hindsight than it is in present tense. And we're still casting about on what do we do. Even if we had great and highly accurate predictions, we don't yet have a lot in the toolkit to change the course of what appears to be coming. Couple words to wrap up on calf health. These automated milking feeders are becoming widespread in our dairy industry. They can be a really good thing to capture some benefits of group housing and higher planes of nutrition for calves. In this study, a PhD student visited 17 farms with these feeders seasonally, 4 times each farm, collected a whole bunch of data on the calves, the feeders, the environment, and so on. To summarize a couple of the things that were associated with calf disease, not surprisingly, if there were high bacteria counts in the milk or the milk replacer, and again, that had to do in many cases with the cleaning of the system. So although these are automated feeders and most of them have an automated cleaning cycle, they all do require some manual intervention. So those cleaning cycles don't always work as they're meant to. They need some supervision, and they all need a little bit of manual scrubbing of nipples and so on. And if that doesn't happen, we get high bacteria counts and more disease. Similarly, when calves are on higher planes of nutrition, they're going to make more manure, more urine, more ammonia, and therefore they need more bedding and better ventilation to really make the system work. Another question is when to put calves into these pens. So mostly we're going to feed colostrum by a bottle on the first day. Some people chuck the calves into the group very soon after. Others wait for as long as 2 weeks. What's best? We did a study at our university herd where we compared putting them into the group at day 1 or after 24 hours versus day 5. To make a long story short, there was a small difference in their milk intake in the first week, but not much meaningful. And it was a bit of a Hobson's choice. So you could spend more time coaching and helping the calves learn to use the feeder versus spend more time bottle feeding them out to day 5, and then they were going to get on to the auto feeder quite a bit more quickly. There wasn't a difference in the incidence of scours, but if and when scours happened, it was worse, more severe in the calves that were put onto the auto feeder at day 1 versus day 5. So early introduction can work. It's certainly not a taboo, but there are trade-offs. It's a bit of how do you want to spend your labor, not necessarily a massive savings of labor. And so at the end of the day, at least based on the day 1 versus day 5 comparison, our suggestion would be day 5, but there's probably some flexibility there. And this one, again, just hot off the presses from some colleagues. This grains of salt here, that there are some numbers to this. This is from 8 farms, but it's very much just a snapshot in time of humans checking, health scoring the calves to detect illness and looking at their auto feeder data from the previous 24 hours. So again, looking at trends over time may well be a better way to do this. So again, few grains of salt, but the single moment in time or 24 hours preceding a snapshot assessment of calf health based on some of the suspects that have been looked at in a number of other studies, being how much milk does the calf drink per day, what percentage is that of what it's allowed to drink, is it drinking the maximum allotment or not, its drinking speed, and the number of unrewarded visits, so the time it comes sniffing around for a meal, but it's not quite time yet. Each of those has been associated, a reduction of each of those things has been associated with greater risk of the calf becoming ill in the days that followed. And indeed, those associations were there, but at least on a snapshot basis, the sensitivity and specificity of any one of them was poor, 50% or less. Again, a coin toss. However, the little glimmer was that used in parallel, so saying, if any one of the above is sort of into the red flag zone, then the sensitivity actually looked more promising, 80+%. So it could be a useful adjunct to detection. So to wrap up for calves, again, these group-housed auto feeder systems can work really well, not necessarily as a labor-saving device, but as a way to achieve the benefits of group housing and a high plane of nutrition, but it also requires a high plane of ventilation and a high plane of bedding. Milk consumption, drinking speed, unrewarded visits are sort of analogous to rumination time activity, milking robot attendance for adult cows. They do fairly repeatedly change preceding disease and show promise for helping flag up animals that are heading in the wrong direction. But the accuracy by themselves is not quite there yet. And in any case, are what to do to demonstrably make the outcomes better is also not really clear yet. And so to finish, lots of promise, but I think the promise will be best realized if we take a little bit of a step back, and future development is based more on what are the unmet needs of the animals and the people working with them, as opposed to what sort of nifty kit can we adapt for cows. I hope the way forward will be to integrate sensors among each other so that the thing on the cow's neck or leg or ear shares data and communicates with the milking robot, the milking parlor, and so on. And importantly, equally communicates with or integrates data from conventional sources. So just knowing that the cow is young or old, knowing what her mastitis history is, knowing that she's fat or thin, that she did or didn't have a tough calving, those are useful predictors, and there's no sense leaving those data on the floor when we could integrate them with her rumination time and activity and so forth. And so with that, I'll finish with a shameless plug for those who'd like to follow our work on social media. The tags are there. And with that, I will say thank you very much for your attention. And I realize we're up against time, but if there's time, I'm very happy to take a couple of questions. Thanks very much.
Big round of applause for Stephen, I think. Huge thank you, Stephen. And again, bearing in mind time zone differences, I really appreciate Stephen obviously going into the department at OVC and things to deliver this too. So thanks, much appreciated. I think time for a swift question. If there's one out there, I've got one. If not, but are there any questions from the floor at this stage? I'll throw one at him if not, if I can. I just really interested in your view, Steve. We got into, and thanks so much for this again today. It's hugely appreciated. We had some good discussions yesterday on farm, and they've carried on today, kind of about what next. And I'm just really interested in what, with this kind of veterinary perspective, just what you think the priorities are, kind of as vets, in terms of engaging in this area. What should we focus on next in this area of kind of precision tech and our role really with farms?
Yes, so at the risk of repeating myself just a little bit, I think where we can help as advisors, veterinarians or otherwise, is in bridging some of those gaps right now where the sensors variably produce, useful and actionable lists of animals that may require attention. as I said a minute ago, those are not necessarily well integrated yet with what we might call our conventional data. And so that might be a little bit of a manual exercise, but I think coming up with some programs and protocols for frontline workers to marry up all three of activity-based or rumination-based, sensor-based data, be that things off of milk or off of cow wearables, bring that along with our conventional data, young, old, fat, thin, tough calving or not, and a selection of farm-specific human interventions. So whether that's ketone tests or other hands-on observations of the cows, I think right now that's sort of our best approach, which requires doing a bit manually, but that does give us the opportunity to tailor things based on the data available on a given farm, the skill level of the frontline workers on a given farm, and the streams of data available on a given farm.
That's great. Well, certainly picked up in terms of the individual farm, the specific farm aspect of some of this. I think it's been really interesting and important. And keen to pick up on some of the young stock data streams, actually. We talked about that yesterday at Wilden Grange, and it'd be great. So I think a huge thank you again to Stephen. Really appreciate your input and look forward to further catching up too.